Hi, I'm Dr. Abigail Zamorano. I'm a gynecologic oncologist with UT Health McGovern Medical School in Houston. And I have with me today Selena, who is a stage 4B cervical cancer survivor from Seattle. I brought her along so that she can talk to us about her story through her diagnosis and her treatment, and also to talk about her advocacy since her diagnosis, because she's really made that an important part of her life. And I think that we can all learn something from her experience. Selena, would you like to introduce yourself?
Thank you, Dr. Zamorano. This is such an experience to be here today. I appreciate being asked about my story. I think my story can bring hope to anyone that's just deep in fear that's been newly diagnosed. I was diagnosed in 2016, December. Uh, Ironically, we didn't know it was cervical cancer. I had been suffering with sinus issues, and the whole thought was, because of my sinus surgery and ongoing coughing and hacking and breathing issues, that I surely just needed a lung exam. Who knows? But it certainly had nothing to do with the whole dynamics of the rest of my body. It was during the lungs that were being checked that they discovered my lungs were 2/3 filled with metastatic cancer. And boy, that was frightening because they knew it was metastatic, but they didn't know what the basis was. I had no vaginal symptoms that I was aware of in any way, shape, or form. So after the lung biopsy was taken, trying to narrow things down and find out medically what could possibly be the origin, my body went into some kind of revolt. And literally within a week before the biopsy results even came back, they were able to say it was cervical because I flared up vaginally. I literally uh, began to feel and fear for my private parts because I couldn't even name them at that moment, what was happening to me. And within 45 minutes of being at my internist office, that's when we realized that, tissue matter was beginning to kick up. And within 2 days later, I was at a gynecological oncologist office. And I'm sorry, this is really gross, but during the examination, I literally was spewing matter out onto the floor. And it just was shocking to hear. It was shocking to feel. So obviously, now that I'm at the baseline of where I'm at, the thought was I'd be in treatment for the remainder of my life, whatever that might look like. And the first line of treatment, chemotherapy that began, I was doubled over in a lot of pain. I literally felt like I could feel the chemotherapy working in my body, just gobbling things up. And got through that, went for my second treatment, and due to one of the medications I was on, I don't know if you want me to name or not, I went into grand mal seizure. And I literally had 12 hours of nightmare hell between a screaming headache and being out. And coming out of that experience, I was further met with the termination of my job, which I could no longer do the duties of my job because I couldn't drive. And being a business consultant and an advisor to large corporations in the Pacific Northwest, I had a lot to come down from. I literally felt like the entire rug had been pulled out of my life for sure for the final time. So I got my house in order, and meaning I gave away everything I owned. I surrendered to care. I surrendered to a lot of emotional care. And just like a trooper, just got through the treatments as they would come. And I had side effects every cotton picking time, every 2 to 3 changes of treatment, they'd have to change again. At the end of 9 months, I'm now sitting down with a team of oncologists and I'm being told we have no more treatment options available for you. The good news is you're now NED. I was like, what? How did that? And the drug that was taken away from me at my second treatment because of the side effect is believed to be the one that actually saved my life. It kicked cancer's butt so hard that it just began a depletion of uh, cells in my system completely, including the metastatic cancer, gone. I'm now 60 years old. I don't own anything. I have no work, career aspects in front of me. I have seen in black and white in writing from Social Security that I'm most likely to die within a year. So here's your disability coverage. Thankfully, I had some other private disability coverage, but I was just literally speechless. I hadn't another cervical cancer uh, patient to talk to once during that entire journey. I, I just was speechless. The only thing I could say without any doubt is that if I was going to be this sick and with this disease, I was in the right city at the right time at the right place because I knew how collaboratively all of our medical community works together. And I knew that my case had been put in front of multiple providers and looked at a lot of different solutions. I was hospitalized multiple times for depleted platelets, infusions, et cetera, et cetera. I was worn out and tired, but I'm supposed to be celebrating and I'm happy because I'm NED. I remember telling my friends I'm 60. I'm not 15, 16 years old anymore. How do I start my life over? What do I have to work with? I should be excited and ecstatic, but I'm just tired. And it took me a while. It took me a while to kind of start putting things together. And I try a little of this, I try a little of that. Thank goodness the complementary services at Swedish Cancer Care has Women's True Family Center, which provides art therapy, crafts, music therapies, therapists, drugs for drugs, all kinds of things to help with the palliative care needs that I had because I had quite a few side effects at that point. And it was just going to take a while to build me up emotionally more than anything. Art therapy meant everything to me, and it allowed me to spin back into some of my old core gifts and skills, creative thinking person that I am, and very tactile person that I am. And I created the piece that has now been donated to Swedish Foundation in gratitude for my care. The one thing I couldn't believe was that I was really clear of the cancer. And at a year and a half, I was correct. I had recurred. And at that recurrence, nothing surprised me. What was curious was would there be any possible clinical trials available for me at that time? What other genetic testing had come about that might provide some kind of clues? Or the opportunity to go to radiation and brachytherapy. Of course, or nothing. I chose the radiation and brachytherapy. They have a great team, and my radiation oncologist is just incredible. I chose that because I felt, given the strength and the physical ability that I had at that time, would give me the greatest propensity for success to beat this down the road. The tumor had returned site specific and pretty dominant within the top of my vaginal core and through my cervix area. Once again, of course, they tried the chemotherapy with the radiation, forget the chemotherapy because of adverse side effects. So that was just off the table. I truly and honestly suffered through every single bit of my radiation and brachytherapy treatments. And I created, I'm sure, extra work for my physician along the way, both physically and emotionally. Can we solve this? Can we solve that? From all the different burnings and damage that those treatments just take. They just do. I had the hardest time getting up every day and going again. And I used to call it the most masochistic thing I'd ever agreed to in my entire life. And then I'd come home and I'd, sit in my sitz bath type of experience and try to get the swelling down and the inflammation in place, so forth and so on. I'm now 4 years NED, and it's been an amazing reclaim of life. I didn't question this time that I was somewhat home clear from the disease, but I wasn't from the side effects. So there's still been a lot of ongoing pelvic floor therapies and different things that I've had to endure to get my strength back and to feel healthy and to feel normal. But I've never not been able to pick up the phone and say, hey, I need some help here. I need a question answered, or, help me navigate through something. I've also since found a world of cervical cancer survivors out there, and it's been very rewarding. And it's also been extremely eye-opening. I wouldn't want to trade places with anybody. None of these diagnoses are really comparable. I didn't realize that in the beginning. Just because one person's stage 4B doesn't mean, like me, you can't live, any more than a person that's just stage 1 can't lose fertility and choices in life. It's heartbreaking, this disabling effects I've seen of treatment with some women from far lesser diagnosis. And I don't know where you want me to keep going at this point, but I feel like I want you to know that I was a woman that always got my exams. If you looked at my records, just 3 years, just over like 3 years and 3 months prior to my diagnosis, I was HPV negative.
Mm.
My exams were clean. And here I was, stage 4B. I'm 59 at the time, and I followed the protocols, and yet my life was on the line. That was alarming to me. And it was alarming to my team so much that they went back and did the research to find out what were the odds. What were the odds of my having a diagnosis like that? And I get it. It's just a number. It's like in the millions, but I'm not a number. And I'm really very, very sensitive to the analytics that go into these things. And it's because of my prior work life and the things I understand from actuarial tables that now make me sick emotionally to think, why are we trying to baseline everything off of the means and the averages? Can't we just broaden those scopes out a bit further? Where else can we put resources? There's so much I'm learning, and there's so much that's still frightening to me.
And I think the thing that jumps out to me in so much of your story too is to remind women to listen to their bodies. And if something doesn't seem right, even if your screening has all been negative, seek assistance, seek a provider. And if you don't feel like your questions are being answered, then find someone who will answer your questions and really advocate for yourself. Um, I know that since your diagnosis, you've also become a supporter for other women going through cancer and trying to help them through that journey. What are some things that you tell women who are currently undergoing treatment to help support them to get them through something that's really challenging?
Thank you for that question. And I think I would start with even women that aren't in treatment is it's okay to know your body. And it's okay if you're not sexually active, but it's not okay if you don't stay sexually healthy. And the importance of really understanding the knowledge of our intimate parts in those scary times. I was not sexually active, but I also wasn't really taking care of myself. So I don't know what kind of wellness you call that. It's just where I was at. I was too busy working all the time, I guess. Women in treatment, um, I think by that time, to a great degree, a lot of them are starting to be a sponge and they're just learning everything they can. I think if they can slow down a little bit sometimes and just be in the moment with the care that's being provided to them, because it can be information overload if you're not careful. And I think it's just so important to be in a community of women that can hear you and can share ideas. As I said, I was in a gynecological group with just ovarian cancer women for my whole first year treatment. And the languages are very different. It's really important to stay out of I think my doctor prescribes this and, too much of the clinical details take away from the spiritual, emotional, physical things you can do for yourself to stay healthy and happy. And that means in relationship with your family members, because things get very, very complex. People get really, really complicated about, do I tell this? Do I know that? Um, who do I tell? What do I tell? Um, do I shut down? Do I shout to the world? It's going to be different for everyone, but I don't think as a solo person going through these experiences, you have to stay locked in yourself. I think there are so many great ways to experience life at this time that are going to help and aid your healing. And I'm convinced, had I not lost my job, I probably would have been trying to juggle work and care, and I wouldn't be here. I
Mhm.
became quite convinced quite early on that not working was the best thing in the world that ever happened to me. It allowed me the time to truly focus in on just be breathing, meditating, doing artwork,
Mhm.
feeling whole, complete, and clean, smelling, fresh
Mhm.
air, watching the birds, taking those walks, whatever it took. Those things really, really matter in your DNA. And, you know, time to eat good foods and drink
Mhm.
good fluids. That's it. I just think, slow down. You don't have to know everything. You don't have to
Yeah.
solve it. And you don't have to go rescue everyone else. It's not your job to do the work they need to do as individuals to care for you.
Yeah. Yeah. As we talked about before, I'm not personally a fan of the term of, you know, things happen for reasons. I
Right.
think that there are some truly terrible things that happen, and that's just what they are. But I really want to kind of brag on you for a second and commend you for the the good that you've created out of your really terrible situation. And frankly, not just the diagnosis, but also, as you talked about the hardship that go into the actual treatment and fighting this battle. It is very much a battle, and you come out of it with some battle wounds. But you mentioned the artwork that you did, the art that is currently hanging in the hospital for other cancer patients and survivors to, gain inspiration from. And then you're also a National Cervical Cancer Coalition chapter leader, which is huge. And then we were talking about how you did a video of your experience and kind of what you've learned through this, that was Emmy nominated. So, I know that through all of this, you've really brought a lot of inspiration to other patients who are going through this. And so even though you've come out of it with some battle wounds, you're helping others, fight their battles too. So I think that that's the what I take away from your story and your experience is how much I'm sure other patients that you aren't even aware of have benefited from your teachings to them.
It's been so lovely for me to have outreach from women from around the world and say, "Can you help me? Do I have what it takes? Can I make it through?" It's also really gratifying to me to work with practitioners or up and coming health provider students and um, researchers, educators in this space. I know even talking to my first oncologist who's now retired, who still is in camaraderie with his first mentor back when the treatments were archaic and the outcomes were even harder, to tell them thank you for the work they did. And it matters. And look how far everyone's come because they fought the fight. And they need the accolades too. This is not work I think anyone in the healing professions can do day in and day out with some sign of hope. It's not easy.
Mhm.
Um, it's heartbreaking oftentimes. And like I said, with the ovarian outcomes, it's heartbreaking to me every time I hear of another woman that's gone. Uh, for any gynecological reason, because whether they're mothers or they don't have the opportunity to become mothers, they're life givers. And part of their life force is just cut short. And that's not why we're here on this earth. We're here on earth to be life givers. And this is a part of our body that, we it's our basket, it's our foundation, it's a piece of who we are. It's not all of who we are. And motherhood isn't the end all to be all for everyone. But I think no one should be without their mother, sister, daughter, and best friend. It's not necessary. This doesn't have to happen. And when I know it doesn't have to happen and it doesn't have to be advanced, there's just no words.
Mhm.
It's ridiculous. And the other thing that's ridiculous is the side effects of the aftercare, the things that are not recognized for insurance reimbursements for us in the modern worlds. Uh, it's it's harmful. It impacts relationships on every level when our health isn't taken care of. And one of the things I've learned from women that work in particular in the Latin worlds is how hard it is for them to even have a space of privacy when they're dealing with children and husbands and jobs and all these things, and they can't or won't take the time to prioritize themselves. It's horrible to think who's going to take care of their families, who's going to be part of that bridge to the next life.
Yeah.
It doesn't have
And
to
I
be
think,
this
and
way.
what you're saying is really so much of our mission statement as those of us who treat gynecologic cancers is, women um, are such obviously a foundation of society and family units. And you're right, no one should live without their partner or daughter or mother or sister. And so we're doing everything that we can to try to, prevent these cancers and then to treat them the best way we can if and when they occur. So,
Thank you for your passion and your focus and your commitment. It's so richly needed.
well, thank you for talking to me today. This was really a wonderful conversation. I know that I learned a lot about someone who goes through treatment, just from what you've said today and your experiences. So I really thank you for taking the time to speak with me.
Thank you, Dr. Zamori.